I'm seeing that the time is rolling here around at 2 o'clock, so I'm going to go ahead and welcome and open this session. I'm Kristen Lodge, the Director of Development and Communications at the Wenatchee Valley Museum and Cultural Center. Welcome to the COVID vaccine Q&A session with the Chelan-Douglas Health District, the Department of Health, and Confluence Health. The Wenatchee Valley Museum and Cultural Center is located on the traditional homelands of the Piscosa Wenatchee. We acknowledge the traditional lands and offer respect and gratitude to the Piscosa and to the diverse Indigenous peoples that reside in North Central Washington today. Our mission at the museum is to engage and educate in the Wenatchee Valley community. Our museum also serves as a community forum, a place where you can meet with your neighbors, learn about issues important to the community, and discuss your thoughts and opinions. While we're not able to gather at the museum quite yet, we are enjoying the opportunity to gather virtually in forums like this until we can be back together again in person. Our goal today is to provide our community with the opportunity to discuss public health and to get your questions answered about the COVID-19 vaccine, availability, vaccination locations, safety, and efficacy. Today, we have Spanish translation provided by Sylvia with Claris Languages. If you're logged into Zoom, you have the option of listening to the translated audio channel. You can do this by clicking on the icon of the globe and selecting the Spanish option. Leading today's conversation is Dr. Malcolm Butler, Health Officer with the Chelan-Douglas Health District, Dr. Peter Houck, Senior Epidemiologist with the Washington State Department of Health, and Joellen Colson, Senior Vice President and Vaccine Coordinator at Confluence Health. I'll be on hand to moderate today's session. We encourage you to participate. If you're joining via Zoom or Facebook Live, we invite you to join the discussion. If you're on Facebook Live, please leave a question and comments. If you're joining via Zoom, you can ask questions using Q&A or chat. I'll monitor your questions and do my best to make sure they get answered. I'd like to give Dr. Butler, Dr. Houck, and Joellen the opportunity to share some information with you first, and then we'll open it up to your questions. Dr. Butler, let's begin with you. Thanks for being here today.
You're welcome. And I need to apologize, Joellen. I didn't recognize you. Joellen and I have known each other for 20 years, 25 years at least. Anyway, would you like me to share my slides, Kristen?
Yes, go ahead.
All right, so I did put together a couple of slides today, just to sort of give everybody a little situational awareness of where we are. And on this slide, you can see my Chelan-Douglas Health District email address. Always happy to answer any questions at that email. Typically, I get to that on the weekends, so if you can be patient with me, I'll try and respond to any questions. So this is what's called an epi curve. This is looking at our incidence rate. The incidence is the number of positive tests that we have seen. And in this case, it's per 100,000 population and over the last 2 weeks. So it's 14 days worth of data. And we do that because otherwise things go up and down too much. And so this sort of helps things smooth out. But the good news is you can see we're way down here at 134. Back here in November, we peaked out above 1,000. So we've had this very nice steady decline over the last couple of months. This is our testing. And for those who haven't seen this graph before, the blue part at the bottom here, those are the positive, the percent positive. The gray are the negatives. And so then the length of the rod or the column is the total number of tests that were done. And you can see this is from last week. So the week finishing on Saturday, I believe. And you can see that 66 tests were positive, 1578 were negative. And this is from all providers in Chelan and Douglas County. And that was a total of about 4%. And we want that percentage to be below about 5%. That means we're doing okay. But what you can see is that we've had a dramatic decrease in the amount of testing as we've come down off the surge that was in mid-November. This graph is colorful and it's interesting. It's different from the other one I just showed you in that this is just 1 month's worth of data. And this is representing the age brackets of the positives. And over here, you can see what the colors represent. And this is just 1 month's worth of data. And we've been watching this pretty closely because you can see right here a big expansion in this orange, which is the 10 to 19-year-olds. And you can see over here, which was just last week, an expansion in the 0 to 9-year-olds. And we're watching that because we're keeping a very close eye on the children, on our pediatric cases, our kids who might be in school, because we are pushing hard to get schools reopened. And we want to make sure that as we're doing that, we're keeping everybody safe. And we've investigated these changes when we've seen them. And right now, today, the latest information I have is that this is all just sort of randomness. The good news is the schools are tracking this very closely also. And so they have an even better grasp on where the positives are. And right now they seem to be spread out fairly evenly across all the different schools. This is looking at ethnicity. Light blue is Hispanic, dark blue is non-Hispanic. This is only 1 month's worth of data also, and this yellow bar is 31%, which is the percentage of our communities that are Hispanic. And back in August, we were at 80% Hispanic, and now we're down to about 40%. So we're doing much, much better as far as the percentage of disease which is carried in the Hispanic community. This then is looking at our mortalities. I like to show this not to be morbid, but just to, again, remind people that COVID-19 is an incredibly dangerous infection. And the youngest people in our communities who have died have been in their 40s. The majority have been above the age of 70. Blue is male, green is female, and you can see that us males do not do well if we get COVID. So we have to be especially careful. I wanted to just show a couple of graphs on the variants, the COVID variants. I know we're going to have some questions about that today. And the CDC has a pretty nice graphic that I stole some shots from. So as you're probably aware, there are 3 variants that are in the country right now that we're tracking. One is called the B117, excuse me, and that's the UK or the British variant. The other is the P1, which is the Brazilian, and the P1351. If you're into the genome or DNA, each of those codes is actually describing the location on the DNA where the mutation happened. So B117 may have been on the B portion. The first arm and the first variant was exchanged with a 7 or something like that. So it's a code which I have not committed to memory. Anyway, so this is looking at the B117. You can see it's in almost all of the United States right now. Really, a lot of it right now in Florida and in Michigan, a little bit less in California. Our state is highlighted that sort of unusual green only because I clicked on it. Otherwise, it would be the same green as Oregon. And you can see right now we've got 39 samples of the B117. We've got 0 of P1, and we've got 1 of the South African variant. And these are just randomly found. So imagine that there is a moth trap in a tree in your garden, and once a month somebody from the research department comes and opens up the moth trap. If they find a moth in that trap, they know that that moth exists in our community. What they don't know is how many of those moths exist in our community. And this kind of testing is the same. We know now for sure that the B117 and the P1351 exist in Washington state because we've trapped them, we've seen them, we found them. But we don't know how many of them there are in our state. And right now we're testing only about 2% of all of the swabs to see if they contain the variants. So this then is looking at the P1351. This is the South African variant. You can see it is in Washington state. It's kind of scattered throughout the US, mostly in the Southwest and in Texas. I'm sorry, that's the East, the Southeast and in Texas. And then this next slide is this P1 or Brazilian variant. And again, you can see it's in Florida, it's up in Wisconsin, who knows why. Interestingly, it's also in Alaska. So Florida right now looks to be like an entry site for a lot of these variants that we're seeing. Next thing I just want to point out quickly is around masking. The CDC a couple of weeks ago came out with a recommendation that we double mask. And I'm going to explain why. At the health district, we are recommending that all of us right now are using the highest quality masking available. If you have already been vaccinated and completed your series, this is less important. But if you have not yet been vaccinated, I need you to be using the highest quality masking you can to avoid this variant, because we're assuming right now it is in Wenatchee. So double masking, why do we do that? Mostly it's about 2 layers. 2 layers of cloth are just better than 1 layer. Wearing a bandana just doesn't work very well. So if you're going to wear a cloth mask, please make sure it's, a fabricated cloth mask that has at least 2 layers. And the other is wearing a cloth mask over a surgical mask. I'm going to point out why. And then finally, you can also knot the surgical mask. So here are some pictures. So this is your local health officer wearing a surgical mask. And what I want you to see are the gaps, okay? So right here on the edge and here under my chin, there are some gaps. So if I throw a cloth mask over the top of that with some elastic around it, it shuts down those gaps, right? And so that's going to keep me safer. If you are wearing a surgical mask over a cloth mask, you're going to look like you don't know what you're doing. So it's cloth over surgical to make it look like you know what you're doing. This then is the knotting technique. And even though this looks like I put the knot a little ways away from the surgical mask, I actually tied that as close as I could to the mask, and then it sort of stretches out. But you can see by doing this, it has put more tension across my chin, and it has closed down that space. And then you can just push a little bit in on the edges, and that'll tuck that in. So you can also knot a surgical mask. All right, that's the end of my presentation, and I'll hand it over to Joellen.
Thanks, Dr. Butler. Always appreciate your updates. You do a great job of inspiring our community to follow good practices. Thank you.
Thank you.
Kristen, I want to thank you and the museum for having me here today. I am a bit of the logistics know-how behind some of the vaccination work that's happening in our community. I do want to give a huge shout out to a lot of community partners. This is a massive community effort. A lot of people are involved behind the scenes, ensuring that we have as much access to vaccine and can deliver it as smoothly as possible into the arms of as many people as possible. We have a saying in vaccine work, all doors are the right door. So if you have an opportunity to receive a vaccine somewhere, by all means, get that opportunity, get the shot in your arm. So the vaccine clinics have been called Disneyland. People love to work the vaccine clinics and volunteer. They say it is the happiest place on earth. So a lot of joy. We appreciate the community's response in getting the vaccine. We have a lot of interest. People are knocking at our doors wanting vaccine. And so we think that's a great problem to have. Supply chain has been a bit of a barrier in the past, but I can tell you right now, we're starting to receive more shipments of vaccine. And so we're feeling really optimistic about that. A bit of state of COVID here at Confluence. As Dr. Butler's presentation indicated, we are seeing declining rates of COVID within our community. So our hospital cases do continue to decrease. As of last night, we had 3 patients in isolation, 2 in ICU and 2 on vents. So vaccination is a big part of the solution for this pandemic. And at Confluence, we've administered over 15,000 doses of vaccine since mid-December. So we're very excited to also support the work at the Town Toyota Center. And that mass vaccination site has been extraordinarily successful. So again, hundreds of community volunteers, also the healthcare partners, whether they're Cascade Medical, like Chelan, Columbia Valley. So all throughout North Central Washington, healthcare and community partners are stepping up to ensure that we can provide vaccine access to folks. Equity continues to be a large focus for all of us. We want to ensure that all population groups that are eligible for vaccine have reduced barriers to getting vaccine. And so we are actively working to address those barriers and ensure that all parts of our community have the knowledge they need to make an informed decision, and then also have the tools they need to get the vaccine. Yeah, I'm just really excited to be a part of this work. As Dr. Butler mentioned, I've known Malcolm for over a couple decades now. I started my career in public health, and it really feels full circle to come back to this. I wish it wasn't a pandemic that made it happen this way, but it is very gratifying to be a part of these incredible community efforts. So again, thank you to the museum, and thanks in advance to all the people that are watching. We welcome your questions. It helps us know how to get better at advocating and educating regarding the vaccine.
Thank you, Joellen. Dr. Houck, would you like to add anything before we dive into questions?
Sure. Actually, I'd like to give some really good news, and then a word of caution, which I think we'll probably try to repeat a couple of times. First, the good news on the vaccination front. If you happen to watch the Seattle Times newspaper every morning, they'll have a lot of information there. One of the pieces of information is the number of vaccinations given in each county in the state per 10,000 population. That allows you to compare King County with millions of people with very tiny places. And I want to give a big shout out to all the people over there who are working. I can do this. I'm just a retired epidemiologist again. All the people who are doing all the work in Chelan and Douglas County. Chelan County has been either the number one, where it was this morning, or number two county in the entire state as far as the number of doses given per 10,000 people in the population. Chelan County, I think, has about 75,000 people. So it's a lot of vaccinations. And I think you can all be very proud of that. It's great work. It's taken a huge amount of really coordinated team effort to get that done. Okay, that's the good part. And again, I think that's really super. The point of caution, Dr. Butler's slide showing the number of new cases, that's encouraging data. The curve has come down from the incredibly high levels we had back in January, when it was, to be honest, it was really depressing. It was not only scary, it was really depressing. If you look at the national data, the same kind of epidemic curve that Dr. Butler described, as well as the state data, you'll see that this really sharp decline that we've seen in the last month or month and a half has now leveled out. And the word of warning there is that we cannot, in any way, shape, or form, give up all the things we're doing: the masking, the social distancing, the avoiding crowds, all the things we've been doing for the last year, up until and through the time we had vaccine. We cannot stop that, because we got burned once before. The very same thing happened at the end of the big surge late last summer. Of course, we had the biggest surge of all that was so terrible over the winter. The same thing could very easily happen again. We cannot give up. We cannot declare victory. We can't say, whoopee, let's all party, because we will get burned again if we don't keep doing what you all have been doing for the last now 14 months. So keep up the good work. Do not give up yet. A couple more months, then we can talk about opening up some more, but don't give up. Okay.
Thank you. So let's start off with the biggest question on all of our minds. And some of this information has changed since we chatted last 2 weeks ago. Can you tell us who within our community currently has access to the vaccine, how they get signed up, and where they should go? Dr. Butler, I believe you're muted.
I am.
We had to take care of that
so,
early on, get it out of the way, right?
And just let me mention also, I'm on call right now. So if my phone goes off, I'm going to have to answer that call. Right now we are still vaccinating phase B1, and those are folks over the age of 65 or over the age of 50 in a multi-generational home. Now, just yesterday, Governor Inslee also added all educators for grades K through 12 to the B1 category. Just happened last night. We were all in meetings together and everybody's pagers going off. Anyway, so the team is working really hard right now on that. And we should expect some kind of a press release either late this afternoon or probably tomorrow as to how we're going to invite in our educators. I think everybody's very excited about that. So that's a very positive change for us. So I think the current recommendation still is, if you can work your way through the scheduling system, and if you can drive yourself or get yourself to the Town Toyota Center, you should do that. They have an excellent setup there. Things are going very smoothly. All I've ever heard is just good news about how that's working. At Columbia Valley Community Health, just as Joellen said, we now have more supply. So for example, we know already that we have enough vaccine for this week and next week. We used to know only about 3 days in advance. And so we are reaching out to our patients who are in the affected categories to check with them. And honestly, anymore, most of them have already been vaccinated. And I assume, Joellen, that you all are doing the same. You're reaching out to your patients.
Yes, we're pulling them in as fast as we can, especially our most vulnerable patients.
Right. So we do have plans in place when we can to take the vaccine out to the vulnerable populations. We're still not quite ready yet to, take strike teams out to various locations, largely because the folks in this first phase have figured out how to bring themselves to us.
And I'm going to ask the staff from the museum who are helping on the back end to find some of those phone numbers and websites for information so that we can post that in the chat,
Thank
both
you.
on Zoom and on Facebook. So we'll continue to pull that information and keep your eye tuned to chat. We received a specific question from the community regarding a 48-year-old with multiple comorbidities, saying they're not yet eligible for the vaccine. And wondering when their turn will be up.
Yeah, so Phase Finder, that was just make sure that the Phase Finder gets into the chat also. When it first started out, that was a little rough, but it's working really well now. And so for sure, if you have access to the internet, go and find the Washington Phase Finder, and it'll help you decide or understand if you are eligible. So yeah, a 48-year-old with more than 2 chronic medical problems is going to be, I think we're 2 phases away. I think that's phase B3. So phase B2 are going to be people over the age of 50 who are in essential industries. So that would be food production. It was going to be educators, though they've been bumped up, and also people in congregate settings. So homeless shelters, jails, ag housing, that sort of thing. So yeah, I think that's phase B3. Joellen, nod your head if it's phase B3. Good. And I think we're probably looking, I mean, unless the supply of vaccine increases dramatically, I think we're probably late March, early April. What do you think, Joellen, for phase B3?
Yeah, I was on a state level call yesterday, and I think as the educators and some of these larger demographic groups move through, I think it's going to move pretty quickly. I also did hear that there might be a potential that they would roll 2 of the next B phases in together. So they're doing population cuts to see if that would be too large of a swath of folks to make eligible at one time. I also did hear that the state may give us 1 week's notice when that change happens. We know that that announcement last night for the educators was so well received, and now everybody wants an appointment, but it does leave us scrambling to ensure that we do have availability. And so in the future, we want to open our schedules as fast and as wide as we can to allow eligible folks in. So I appreciate that there might be more advance notice in the future.
This is said by a woman who needs to schedule 500 patients in per day. Yeah,
That's
little
right.
advance notice is helpful.
Good. Well, we'll look forward to discussing that further as we have the opportunity to meet again in the coming weeks, particularly as it relates to teachers and childcare workers. I know that'll be a large portion of our population that'll be very excited to get their vaccine. What that means for the rest of the community as they're trying to get scheduled as well will be an interesting conversation. I'd love to turn to the Johnson & Johnson vaccine. It sounds like we've received emergency approval from the FDA. What can you tell us about this vaccine, and when do we expect that it might become available in our community?
I'm going to let Dr. Houck have a turn at the microphone.
Okay, thank you. Yes, as you mentioned, Kristen, the Johnson & Johnson vaccine, trying to get the shadow off my nose here, received its emergency use authorization this past week. And it may very well have arrived in the community already. Joellen or Malcolm, have you heard if it's shown up yet?
I believe that the number that I heard was the state was receiving almost 61,000 doses of Johnson & Johnson. I believe that that is potentially arriving next week.
Okay.
I don't know yet if any is coming to our community. And then I did hear that there would be a lag time until 3/23, which would be the next allocation date.
Right.
And so as with our other vaccines, I think that supply chain just needs to kind of get rolling.
Yeah, a couple of interesting things there. I believe Johnson & Johnson said maybe almost 4 million doses in the next 3 or 4 weeks. However, there's been apparently a deal cut between Johnson & Johnson and Merck, another vaccine maker. Merck dropped its vaccine because it was not found to be effective, and they are now making. They just signed an agreement to help Johnson & Johnson make theirs. Now, the vaccine itself, there are some big differences and some very important differences. First of all, it's not an mRNA vaccine like the Pfizer or Moderna. It's a different technique. But of more practical importance is that it just requires 1 dose, which of course means 4 million doses takes care of as many as 8 million doses of Moderna or Pfizer did. That's one important thing. The other thing is that it doesn't have to be kept at the really cold temperatures like particularly the Pfizer vaccine. So logistically, it's much easier. It means you don't have to have a return appointment. We don't have to keep track of all those people. And that's really good news. And it's especially good news if we're talking about parts of the community that might be harder to reach. For instance, if you have some people up in, I don't know, perhaps Waterville, where it's not quite as easy to get to Wenatchee as it is from Kashmir. Some places geographically isolated, you don't have to worry about the freezers and all that stuff. It's much easier. Now, there's been some issues, some questions that have been raised about how effective this vaccine is. As you may recall, the Pfizer and Moderna vaccines are advertised as having 90 to 95% effectiveness. Those are based on studies that were done before the Johnson & Johnson studies were started. Excuse me. So there's a little bit of a difference in the types of virus that the Johnson & Johnson vaccine was up against. Some of the new variants were beginning to come into the population, and that may have affected things. The advertised effectiveness of the Johnson & Johnson vaccine is a little bit lower. But the important thing is that it's still 85% effective in preventing severe disease that requires hospitalization, and especially disease that ends up in death. And those are the ones that we're really concerned about. Remember that probably close to the majority of infections either had no symptoms whatsoever or had very, very, very mild symptoms. The ones we really are most concerned about are the ones that put people in the hospital or kill them. And the Johnson & Johnson vaccine is still extremely effective in preventing that type of infection. So it's a darn good vaccine. And I think the important thing to put out there is not just look at these 3 numbers that are advertised, the 90, 95, and 85 or 70 or whatever. Don't look at that, but consider that they are all extremely good vaccines, and you should get whichever vaccine you possibly can. That's the key here. Get as many doses, get as many arms vaccinated as we possibly can, as quickly as we can. And that has some importance not only for each of your individual health status, but also remember we're in a race against the virus itself and the development of these new variants. So the faster we immunize the most people, the better off we'll all be.
Yeah, I mean, I think what we need to recognize is we are in hand-to-hand combat right now with this virus, right? And when you're in hand-to-hand combat, you just grab the closest shield you can find. You don't go and stand in line to get a slightly better shield. You get the shield which is offered to you to protect yourself from the virus. I'm also going to ask Dr. Houck a question, because back when I heard that the mRNA vaccines were 95% effective, I was thinking, sweet deal, we may be able to eradicate COVID. We may be able to be a COVID-free universe here, in a few months. But I've given up on that. And so I'm going to ask Dr. Houck, what are your thoughts right now about herd immunity, Dr. Houck?
Oh, the famous herd. I love the herd immunity. All I can ever think of are a bunch of cows. And okay, so let's talk about the concept of herd immunity, which I actually I'm going to recommend you not dwell on too much, but let's talk about it. So if you have a herd of cows, a herd of, well, not ducks, a herd of sheep, or a herd of people, if enough of those people in that herd are immune to the disease you're talking about, in this case, COVID, there are fewer and fewer people that the virus runs into that the virus can infect, because more and more of them are immune. You can get immunity either by having the disease itself, that's natural immunity, or you can get immunity from the vaccine. Now, a couple of reasons why I suggest you don't spend a whole lot of time worrying about herd immunity is that, first of all, we don't know exactly what proportion of the population has to be immune to this virus in order to have herd immunity, to stop the spread of the virus. You may have heard Dr. Fauci initially say something around 70%. Later on, he changed that to somewhere around 85 or 90%. Fact is, we really don't know. It's probably somewhere in that range. I wouldn't worry about it. Second caveat is that we really have very little idea, I would say essentially no idea, as to what proportion of the Chelan-Douglas population has been infected with COVID and might actually have natural immunity. All kinds of guesses, but we really don't know. We also don't know how long natural immunity lasts. And we do know, we have a pretty good idea how many people have been vaccinated, so we can calculate that. But right now, again, I wouldn't worry too much about herd immunity. I would worry more about getting as many doses of as many vaccines into as many arms as we possibly can, with the idea that eventually we might reach this herd immunity status. But right now, I'm not worried about that. I'm worried about just protecting as many people as possible. So does that cover?
Well, yeah, I mean, the reason I brought it up was, for example, if we have a measles outbreak somewhere, we are going to work to wipe out measles. Measles is almost completely wiped out already. If we have an outbreak, we go after it. And the measles vaccine is like 92% effective or something. And I used to, like I said, I used to think maybe we could do this with COVID. I've changed my mind. I think that we will all be getting additional doses of vaccine in the future.
I think you're right.
With these variants, and there's going to be more variants and more mutations. And I bring it up just because if all of us are anticipating getting additional doses of vaccine each year going forward, then it kind of doesn't matter if you're getting the mRNA vaccine or the Johnson & Johnson vaccine, because it's just your first effort, right? And
right.
Because it looks like herd immunity may not be on the horizon, may not be possible for us, it's going to be more like like influenza, where each of us gets a flu shot every year.
The other thing that you sort of touched on a little bit there, Malcolm, was the variants. Now, if the variant that becomes dominant, say 6 months from now, is way different from the variant than the virus that was circulating 6 months ago, that may actually drop the community's sort of level of immunity somewhat. So we in fact may never reach herd immunity because the virus may be one step ahead of us. I think you're absolutely correct in thinking that this is going to be with us for a long time, and we're probably going to require some kind of annual or every other year booster dose that takes into account the changes. And I know all of the manufacturers, or at least the three that we have working in the country now, are already thinking about this. And one of the beauties, the true beauties of at least especially the messenger RNA technology, is that they can change what they're making very quickly. It's not like the influenza vaccines we're using now that the virus has to be grown in 30 million eggs, literally in eggs. It's a very long process. It doesn't turn on a dime whereas this new technology really can't. And I know that the companies are beginning to work on the new variants and thinking about booster doses or some sort of additional protection for people.
Dr. Butler and Dr. Houck, thank you for speaking to the variants. That was something I wanted to discuss today, and we've been seeing questions come in about that. I want to interrupt for a moment. We're seeing some questions and concerns being shared about the safety and the efficacy of these vaccines. Can you speak to that?
I'm happy to. I'm wondering though, Joellen, do you want to take a swing at that or you want me to?
Oh, wow. I really think that's your bailiwick there, especially the safety. I think we've really done a good job of the efficacy and the numbers, the data behind it. I think safety is a big concern of some of the population. So definitely, I think that would be great to address, Malcolm.
So, yeah, multiple things. My takeaway is that these vaccines are probably safer than water. Probably safer than water. There are more people dying in this country from water than from these vaccines. Now, it is true that the mRNA vaccines, I think it's 1 in 10, it's either 1 in 10,000 or 1 in 100,000 people have an anaphylactic reaction. And an anaphylactic reaction is a very severe allergic reaction. And even though it's super scary if you are not a physician, as a physician, we know what to do with that. We do the same thing with every single person, and we know how to take care of that. And we have easy access in our communities to stabilization and transport to an emergency department. So yes, super scary, but not scary like a gunshot wound is scary. Scary like we have to do something and we know how to do it, and that's what we're trained for. So very, very safe. I have not heard of anybody in this country dying of the vaccine. Of course, I have not been at all the vaccination sites. There was a study done and published of all the vaccines done back in December. And at that point, out of 2.3 million doses given, about 20 people ended up in the hospital. A couple of them had to spend the night and they all went home the next day. That was back in December, and we've got way, way more doses in so far. But again, we're not hearing of big, bad, troublesome outcomes. It would be correct to say, yeah, but we've only been doing this for 2 or 3 months. So how do you know that in 6 months, you're not all going to grow horns out of your head? And the answer is we don't until we get there. However, we have used vaccines like this in the past in animals, and none of them grew additional horns after 6 months. So, it is new technology, super exciting, and built upon a bunch of animal studies. So we do have that kind of information. I've heard people who are concerned that these vaccines may rub against their ethical or moral backgrounds because they're concerned that maybe they were developed using aborted fetuses or other tissue. And it's important that everybody understands that in the factories that are building this vaccine, there is no fetal tissue being used. In the research that has been done in the development of mRNA vaccines over the last 20 years, human cell lines have been used. And human cell lines come out of one of two different sources. Either they are taken from an embryo, or they're taken from a cancer, because in both of those conditions, those cells will just reproduce forever all by themselves. And so then we can grow those cell lines and put them in petri dishes and do experiments on them. But that's the research that was done to develop the technology. So the analogy would be we're using a Xerox machine to look at the DNA of the virus. We're taking a Xerox copy and we're using that to build the vaccine. If any fetal tissue was used, it was used in learning how to build a Xerox machine. It was not used in building the particular virus that we are now injecting. I've also heard concerns that, the virus it was too fast. How could it possibly be true? And again, I think that Xerox machine is a great example or analogy. Back 10, 20 years ago, we had to sketch the DNA. We had to pull out our crayons and draw the RNA, right? We had to do it all by hand. It was an incredibly labor-intensive process, and we didn't have the technology we needed to look at the genome. And so as Dr. Houck said, we were injecting bits and pieces into viruses and then injecting those into eggs and letting the eggs incubate and cracking them. And it was ridiculous. But now we've literally got a Xerox machine. We can just Xerox the viral DNA, and then we can crank out as many copies of the mRNA as we need. So it's just a fabulously modern technology. And if it used to take those of us who are of a certain age a long time to handwrite our essays for school, now we can type them up. It just goes way faster. So the new technology has allowed this to happen much more quickly. Also, the thing in the past that really slowed down the process was that a company was trying to make a profit. And to do that, first they had to develop their vaccine, then they had to ask for money so that they could study it. And then they had to do the studies, then they had to ask for more money so they could do the next study. And then they had to go back to the government and ask for more money. And so it took 10 years just to, do all the research and generate the money and get the grants. Well, money was just thrown at this problem. And so all of them were doing these things in parallel. They were building their production facilities while they were doing their large-scale studies. So at the end of the day, no steps were skipped. Obviously, it was done at an incredible speed, and it is miraculous that it has worked so incredibly well. But you do not need to be afraid that the vaccine is dangerous just because it happened to be produced in a beautiful new way. And I can tell you, well, I don't know Joellen, but I can tell you that Dr. Houck and I were both first in line to get vaccinated. So we know a lot about it, and we feel very secure that it's a very safe vaccine.
Thank you. I feel like you've addressed each of those questions and comments in your comments, so I appreciate you taking the time to go through that. Let's talk a little bit about vaccine side effects. What side effects can be expected after receiving the COVID vaccine, and what tips do you have for people hoping to ease those side effects?
Ooh. Well, Dr. Butler, you and I have been vaccinated, and I'll give you my experience. I haven't been Moderna vaccine. The first injection, I didn't feel a thing, and I was actually a little bit worried because I didn't feel a thing. My arm got sore. I got the vaccination at about noon, I think it was, and I rolled over in the middle of the night, and my left arm was sore. That was the first dose. That was it. As I say, I was a little concerned because the reason why you have a side effect is that your immune system is reacting to the vaccine. And I thought, geez, well, maybe either there's something wrong with the vaccine. No, maybe there's something wrong with me. My arm got sore enough that time. Okay, second dose. Now, at least the sort of common wisdom, I think, is that the second dose is where people might have more side effects. That's because your immune system is already kind of primed and revved up and waiting to have this vaccine injected, and you get a little bit more robust response. Well, in fact, that was true. Although I got my second dose at noon, and I was really disappointed because I didn't feel bad until the middle of that night when my arm got a little bit sore. The next day, I felt a little bit of kind of achiness. The most noticeable thing I had was I was really tired. On the second day post-vaccination, I was just really tired, and that was it. Malcolm, what about you?
My experience was very different. So after the first dose, my arm was pretty sore, and Tylenol made that go away. But, every time I moved, I could tell. But also the gyms had just opened, and so all of my muscles got sore. And I thought maybe it's because I'd been back in the gym for the first time in a few months. But again, Tylenol was all I needed. That went away. Boy, after the second dose, got it on a Thursday, worked in clinic all day Friday. I was uncomfortable. Taking Tylenol all day long. Saturday morning, got up, took a nice long hike, was feeling fine. Saturday afternoon, I was wiped out, had to go to bed. Saturday night, I went to bed wearing a down parka underneath the bedclothes. I was up every 4 hours, drenched with sweat, taking Tylenol. And Sunday, I felt really horrible too. It wasn't about Tuesday before I stopped needing the Tylenol. So I describe it to my patients as it can be pretty bumpy, especially after that second dose. But Tylenol makes it go away. As long as you're taking your Tylenol every 4 hours and staying well hydrated, you're fine. We have seen in long-term care facilities some elderly folks in their 80s who ended up going to the emergency department because they stopped eating and drinking and they got kind of dehydrated. And somebody with dementia, you just can't explain to them, what's going on. And so they were a little bit more distressed. So I would say stay well hydrated, plan that for the 2 days after the second dose, you may need some help with your housework and getting things done. You may not be able to go to work. At Columbia Valley Community Health, we had about 40% absenteeism after the second dose in our staff. So pretty high, way better than ending up with a tube in your throat. So Joellen, what are you guys telling patients to do after their vaccines?
Yeah, pretty much everything that you've mentioned. I would say response to the vaccine is really 50-50. You know, you talk to 50% of the people and they're like, man, it was easy. I felt nothing for either shot. And the other two did have some symptoms. We did not see absenteeism quite as high as you did. I did receive the vaccine. I don't even think I had a sore arm after shot number 1. Shot number 2, I worked throughout the day, had some weird kind of just felt off my game a little bit. But other than that, business as usual. So yeah, it's one of those things, if you can schedule the appointment before a weekend or plan on working from home, if you have schedule flexibility, I think those sorts of things are wise. But again, goal to get shot in arms. If we put too many parameters on it, people wouldn't get the shot. So we just encourage people to cross their fingers and hopefully they'll be in that 50% that doesn't feel a thing.
Good. Thank you for sharing that. As we talk a little,
I might just add something on that. I mean, all of us have had many different vaccinations. And I can think of one I had that made me feel far, far, far worse for a disease that was much less likely to kill me. And I think the trade-off, in my view, is a pretty good one, to be a little bit tired, have a little bit of body ache. Now, some people have a reaction, but keep in mind, this is a trade-off. And it's pretty liberating to know you're not going to get a serious infection with this particular virus.
And people like me who are either weak or just complain a lot, I just want to say I'm going to have way more robust protection than Dr. Houck.
Oh, I want a third dose. I feel cheated. No, actually, I had enough of a reaction. I feel pretty good.
as we talk a little bit about symptoms, we're also looking outside and seeing signs of spring outside and the beginnings probably of allergy season. And as we start gathering again, we're probably seeing the return of colds. If people come down with the sniffles or a sore throat, are health experts recommending that they stay home, get a test to confirm they don't have COVID, or carry on as normal?
Yeah, that's a great question. I'm going to disagree with you in a couple of places. And I'm going to preface this by saying this is changing almost day to day. So as of today, again, in kids right now, we have essentially wiped out the common cold. Most pediatric practices are down about 20% in their business, and that's because kids aren't coming in with runny noses and earaches anymore. And that's because we're all wearing masks and we're socially distancing. So I think infectious viruses, if we're all being really good about, as we have been, masking and distancing, I don't think there's any increased likelihood that they are going to strike us. Allergies are different, yes. And I think most of us, you can tell by my voice, and perhaps Dr. Houck's cough, many of us have allergies, and we know what those feel like, right? If you have itchy eyes and you've got postnasal drip and your dog is jumping all over you and you know you're allergic to your dog, it's an allergy. I would say if you have a new symptom that just does not make sense to you, it's possible it's the first time you've ever had hay fever, or it's possible you've got COVID. So what we are doing now, if somebody comes in and they have COVID-like symptoms, so especially if they've got a fever or a cough, we are absolutely going to test them for COVID. If all they've got right now is a little bit of a sore throat and postnasal drip, I think we're probably, and they've been carefully masked and they're not aware of any exposures, because the incidence is so low right now, I think we may talk to them. If they are working in a high-risk situation, maybe they are working in a nursing home, I'm going to test them for sure. But if they work from home the whole time, then I think maybe I wouldn't test them. So I don't know that there's a straightforward answer, except if you have some of those classic symptoms, you've lost your sense of smell or taste, you've got a fever and you've got a new cough, then for sure we would test you and we would want you to come in and get tested for that.
can I add something about sort of the weather change? That it goes back to what I said at the top of the hour about not loosening up too much on what we're doing in terms of masking and social distancing and all. There's been a lot of speculation, a lot of talk about how this may be seasonal and how as the weather improves, there'll be less transmission and so on and so forth. Keep in mind, though, that the second surge, the one before this big one, was in August, basically July, August. It was still hot. The other thing, my own experience, I work a lot in Colombia, the country of Colombia in South America, in a very, very, very hot city. It's hot year round, and they've seen the same cycles of surges there as we've seen in the Northern Hemisphere. So I don't necessarily buy into seasonality and weather as being the cause of these surges, nor do, the point I want to make now is, nor can we use that as an excuse or a reason to kind of let up on things now just because the weather's getting nicer. Don't keep wearing your mask. Keep doing all those things. You can't give up yet.
Thank you. Dr. Butler, you had talked at the beginning of the session about your desire to reopen schools. Can you give us an update on schools and on spring athletics and some of the changes that we're seeing coming?
Yeah, it's interesting that you mentioned the school athletics. We have a hypothesis that a lot of this increase we're seeing in kids right now might be related to athletics, not because of transmission that is happening on the soccer pitch, but because it's just increased groups of young people gathering before and after traveling to practice together or whatever. I drove past the rack the other day and saw several people climbing out of a car to go and practice tennis. Anyway, so yeah, we are, Chelan-Douglas has been ahead of the curve, especially in Washington State, actually all across the country, in trying to get kids back inside of classrooms. We've tried to be very cautious and methodical. We have made a small change. We've invited a group of 5 kids back, maybe who have special needs or who don't have access to the internet. We watch them for a couple of weeks. If that seems okay, maybe then we expand that group from 5 to 10. We keep an eye on them, make sure everything's working. And so by doing that since last September, we are now to a point where most school districts have about 50% of kids on campus at all times. Now, everybody would like that to be more than 50%. The difficulty we are in is that to do that with the essentially 40-foot or 50-foot by 50-foot classrooms that we've got, you can't fit more than half the class in there and maintain the 6-foot distancing. So if we do push above right now the limit of 15 in class at a time, we start pushing into some of these mitigation strategies like a 6-foot distance. So we're thinking we may attempt this. We have some school districts who are very excited to move forward and get more kids back in class. And so we may start again doing some cautious trials in those school districts. And if we can demonstrate that it's safe to do so, then other school districts may adopt that. We do want to do this if we can now in the spring so that we sort of know how we should set up for next fall, right? So next August and September, as we're thinking about getting back to class, what should we be doing? I think the difficulty right now is we know our mitigation is working inside of classrooms. We know that the masking and the hygiene and wiping everything down and keeping kids out of class and keeping the cohort size down to 15 is working. What we don't know is it like 10% above what we need to do, or is it like 1,000% above what we need to do? What I don't know is maybe we could have all 30 kids back in the classroom, and as long as everybody's wearing a mask, maybe that's going to be totally safe. We don't know. And so we're being abundantly cautious. And then we're gradually reducing that amount of caution. And as soon as we see any evidence that the virus is broken through, then we can say, okay, now we know exactly how cautious we need to be, and we can increase the amount of caution. I think the red herring in all of this is the variants. We know that the variants are stickier than the current virus. If they touch you, they are more likely to infect you than the current variant. And so it's possible that if we're only, say today, 20%, our mitigation is only 20% more than we need to keep everybody safe. Maybe the variant is going to overwhelm that. We don't know. Or maybe not. Again, if we have 1,000% margin of safety right now, then the variant is still going to be a non-issue. Again, so right now, proposals are being put together for us to review, I guess for me to review, and then they'll be taken to school boards. And obviously there are many constituents in this. It's not just the kids, it's not just the parents of kids, it's not just the educators, it's not just the school board, it's not just the health district. It's all of us working together to try and do the best we can to get kids back in classrooms while keeping everybody safe. Athletics have restarted, as you mentioned. I know last weekend we started having our first organized games. My understanding is right now that only the athletes and coaches are allowed at those games. Parents are not allowed. I'm getting questions from people. Yeah, but if we have the parents stand outside the fence, can they all look in? And that's really defeating the point. As much as we all really want to watch our kids doing their athletics, as Dr. Houck said, this is not the time to let down our guard. So let's have the kids, participate in teams, learn what that means, stay fit, but let's just minimize risk as much as we can in those athletics. We are aware we've seen outbreaks. We've seen outbreaks in wrestling tournaments. We've seen outbreaks in basketball tournaments. So we do know that tournaments that happen outside of the school, so extracurricular athletics, have been a source of outbreaks throughout the course of the pandemic. So for sure it can happen.
Thanks for speaking to that. I see that we're nearing the end of our hour, so I'd like to invite each of you to share your closing thoughts regarding the vaccine, the virus, or perhaps kind of the state of health in our community.
I'd like to go back to what Dr. Houck said, that we're leading the state in vaccination numbers according to our size. And that really speaks to the community that we are. I hope that we can also lead in equity work, really leaning into populations that may not otherwise have the information or the ability to access how to get a vaccine. There is a local campaign called Get One, Help One. So if you have received the vaccine, it's kind of hard sometimes to call. You have to keep calling, or PrepMod is a web-based portal. If you get one, help someone else who's eligible get a shot. I guess that's my ask to those of you that have already benefited from the vaccine is grab your eligible neighbor, reach out via Zoom to a senior citizen, help somebody else, and then really continue these efforts, Kristen, so that we can answer questions and ensure that everyone has the information needed to get the vaccine.
Dr. Houck.
Yeah, my final thought is goes back to what we discussed earlier about the epidemic curve that Dr. Butler showed. I think we're at a crossroads, or maybe a fork in the road. The numbers have come down, but as I mentioned, the state and national numbers, the decline seems to have stalled a little bit. There are a bunch of possible reasons, but one of the possible reasons is that people are not.
Oh no, Dr. Houck, you have frozen.
You froze.
And they're all effective right now against the variants that we have. Get vaccinated. Number two, continue doing all the things we've been doing for the last 14 months. We can't give up yet. We're at a turning point. If we do the right thing, the curve will continue flat, but we're at some risk for having it go back up again. So don't give up yet.
Yeah, and I agree with that. I'd just like to express my gratitude to Joellen and Confluence Health for the incredible service they have provided to this community, to Dr. Houck for his service, to the museum for your service. I don't know if any of you have been on the other side of the state and have any idea of what the healthcare system is like over there, but they would rather eat each other than partner with each other. And I think one of the reasons we've been so successful, as Joellen mentioned, is we're all in this together. This is our little valley, and there's nobody here to help us but us. And I just very much appreciate the very close ties that we have, and the fact that that we are willing to support each other, as Joellen said. just mentioning that we might knock on our neighbor's door and invite them to let us help them obtain the vaccine. It's an incredible part of this community. So thank you very much, Kristen, and your team for putting this on today.
Thank you for being here. I recognize that the virus and its effects have been polarizing for our community. As you said, this has been a very difficult time, and I really appreciate the opportunity to support the public health efforts in our region and the opportunity for us as a community to learn from you about the vaccine and the hope it offers in shielding our community from the effects of the virus. So to our participants, I want to thank you for your constructive and productive questions. And to our panelists, Dr. Butler and Houck and Joellen, I thank you for your participation. I sincerely appreciate your time and the opportunity to learn from you about your work. I also invite you all to join us at the museum. The galleries at the Wenatchee Valley Museum are open from Tuesdays through Saturday from 10 to 4 with limited capacity. We have engaging events coming up online, such as the opportunity to get hands-on with makerspace projects and support local businesses through our Made in Wenatchee tasting series. We look forward to inviting Drs. Butler and Houck and Joellen back again in 2 weeks on March 17th from 2 to 3 for the continuation of the Vaccine and COVID Conversation series. You can learn more and join us at WenatcheeValleyMuseum.org. Thank you all for joining us, and we look forward to seeing you again soon.